Many certified veteran service officers do not feel it's worth the time it takes to file since bladder cancer is not on the presumptive list. Is it best to look for another officer?
I mean, you can look for another officer, but the fact of the matter is that a good veterans service officer can oftentimes link the exposure to another primary disease. As I said also, that the VA oftentimes, or can oftentimes, determine that your exposure is related to something else closely related, such as Agent Orange exposure in the cases that Dr. Taylor mentioned. A good service officer will work with you, and you need to try it. You need to try it, folks. Don't give up just because you've heard stories out there.
Can a denied claim be revisited after the veteran has passed away?
If the claim was filed before the veteran passed away, yes, that's definitely. Work with a service officer to handle that. If the claim was not filed at the time of the veteran's death, I'm sorry, the only thing you're eligible for may be the DIC benefits.
Okay.
Disability and indemnity compensation.
What studies have been done to determine the correlation between service in Vietnam and bladder cancer?
There are no documented studies. When I've searched in our kind of repository online for all published research is called PubMed, and there's nothing when I've done searches between Vietnam veterans and bladder cancer. There's nothing on that specific subject. And I've looked through what I know to have access to, which is very little, of the veterans online, sort of Veterans Administration websites, and not found any documented numbers for Vietnam veterans in particular.
Well, I think that's probably good evidence to the fact that we probably need to take a closer look at bladder cancer in the veteran population, because there's
Absolutely.
Because I looked as well from the Beacon perspective, and we didn't find a whole lot of evidence in terms of numbers and studies that have been done. So thank you. Is there a link between prostate cancer and bladder cancer?
No, there is not, and I did mean to mention that earlier because I know that was one of the sort of previous posted questions. With prostate cancer, there are very few occupational or exposure type of risk factors that we know of. Prostate cancer is known to occur more or less with age. If you live long enough, you will probably be found to have prostate cancer, but it doesn't match or correlate or associate in any way with developing bladder cancer. The only exception I would say is if you have radiation for prostate cancer, that can potentially increase your risk of the bladder lining to then come down with bladder cancer.
Of 2 successful appeals for the Agent Orange claims that were mentioned by Dr. Taylor, were either of the cases decided solely on bladder cancer, or was there secondary claims such as exposure to diesel fuel? Do you know anything about them?
They were secondary exposures to Agent Orange, which of course in most cases was mixed with diesel fuel so that it would stay adhered to the leaves of plants.
Do you have any guess as to what the status is in terms of the Vietnam Veterans Association's effort to get the VA to recognize bladder cancer as Agent Orange presumptive? Is this something that we can be helping them to do? Is this something that's being done at all? Do you know?
Well, in the case of Vietnam Veterans of America, we continue to press the IOM to review the literature. But as Dr. Taylor has already said, it's almost impossible, if not outright impossible, to find any research that actually includes a veteran cohort in their bladder cancer and arsenic studies.
Correct.
So we just keep pressing them, and we send them a list. Actually, let me describe a little bit. The last IOM meeting that we contributed was about a year ago, and we submitted a list. I believe it was on the order of about 20 pages most of which were animal studies, which of course in many cases that's the first line of research because you can't practice this stuff on humans. But in any case, that's what one of the efforts that we do is we present the IOM with a list of citations after combing the scientific literature, and then we hopefully the IOM panel will pass the information on to the secretary, who then can make a subsequent determination.
How do you approach your doctor to do this letter, since they're the one that saved your life? And if you're a smoker, do you not even bother to apply because they'll say it's because you were a smoker?
Well, I don't know if it's possible in many or most cases to be able to attribute two different risks when there is a case of bladder cancer. People have tried to study how much a person smoked, how many years they smoked. We use the term pack years. If you've stopped smoking 30 years ago, does that mean it can't be associated? Unfortunately, if you've smoked at any point in the past, and there's not a magic threshold that will increase your lifelong risk of coming down with bladder cancer. I don't know specifically what the process is when the Veterans Administration looks at any of these submissions or applications, so I don't know how they would rank or compare a risk, of a chemical in a certain era to, many years of smoking. It's hard to know. I don't want to speak for the adjudicators of these claims at all, but
one of the confounding factors, of course, is the fact that in Vietnam we got free cigarettes,
and that was almost an outrageous sort of act that were,
right.
These tobacco companies were trying to make sort of care packages for the veterans, and look what happened. Or not for the veterans, for the active duty military suffering, in
Right.
Vietnam.
Why isn't there a consistency with regard to approvals nationwide? It appears that some district offices approve bladder cancer and others don't.
From the perspective of Vietnam Veterans of America, this is true across the VA. There's a lot of variability amongst the VBA offices, because that's what we're talking about here. And so you'll find that some offices, regional offices that I was referring to earlier, process certain kinds of claims at a higher volume than they do in other parts of the country. This is also another issue that Vietnam Veterans of America is embroiled in, and that is consistency across the country. In other words, the adjudicators should use the same criteria across the country. We're trying to deal with that as well.
I'd like to thank everybody for joining us for this webinar. Thank you so much, Jennifer Taylor, Jennifer Dimick, and Tom Berger. You guys were wonderful. So thank you all very much.